This is a 90-90 hip sequence. So we are going to come into the 90-90 position for our lower body. So that is 90-degree angle with our front leg, femurs, and with our back leg. If it is challenging for you to sit upright here and you feel like you are collapsing out to the side, or you can't sit upright, or it's cramping and feeling very uncomfortable in this back hip, you have a few options to find yourself in the proper position for your unique body. Okay, you can bring the back foot in, so taking it from a 90-degree angle to closing that knee joint to allow for a little more space in that back leg, okay? Less internal rotation of that back hip. Second option is to pull the front leg in as well to limit the amount of hip external rotation. Third option is to kickstand yourself out to the side. So if our right leg is forward, we will kickstand out to the right. And you'll kickstand out at varying degrees depending on your body. So you might only need to kickstand out a few inches just to take your spine out of this lateral flexion. You might need to come out pretty far, and you may even need to come all the way down onto your elbow until you gain that range of motion to come more upright, okay? Our goal is to find the position that we can do the work in where it feels like we are at our max range of motion without compensating anywhere else in the body, okay? So we are primarily working the hips. We don't want to compensate in the pelvis or in the lumbar spine or at the knee joint, okay? So just the hips. So find your position, whatever feels best for you. If you feel like you're still limited, you can always use props as well. You can prop pillows up underneath your hips so your legs are slightly lower from your hip joint. So find what works for your body, get into that position, and then we'll do the work. Okay, so we are going to start with kinetic stretching into the hip joint first. So kinetic stretching is actively moving your body forward and back into this front leg, okay? Kinetic stretching can be done in any body part in any movement, but specifically for this work, we're going to be doing kinetic work into this lead leg. Okay, we're going to think about actively lifting this leg off the ground as if we are doing this, okay? Nothing's going to change in our body. We're going to reach our tailbone back, reach our navel forward, and lift the leg to shift our body forward. From here, we're going to keep lifting until we switch. Then you're going to drive your foot, shin, and knee into the ground to propel your body upright. Nothing changes in the spine or anywhere else, just the hip joint, okay? Lift the leg to shift forward, pause at the bottom, continue to lift, and then switch the direction. Drive your leg down and then drive upright. Okay, continue like that. Hands can be supported on the ground. Hands can also be by your side, squeezing your shoulders back and irradiating tension. So we're trying to tighten up everywhere in the body as we move through this kinetic stretch, okay? Whatever you need to gain more tension. So maybe that's squeezing fists, maybe that's crossing your arms over the chest. If you need more load, maybe that's bringing your arms overhead. I would not start with the arms overhead, so find something that's accessible to you. We're going to hold at the end of this next one, so find your end range of motion, and then the hands will come forward in front of you to support you. We're going to do a passive hold here. So holding in this stretch, we're maintaining the tailbone extending back, maintaining the navel reaching forward, so there's no flexion in the lumbar spine and there's no shifting in the pelvis. So find where we get that deepest stretch in that right hip joint, okay? Taking a couple big deep breaths here. If you're trying to gain more range of motion in your external rotation of your hip, I encourage you to spend longer time here in these passive range holds. And after you do the passive range hold, you would move into the PAILS rails. For the purpose of saving time on this video, I'm not going to do a long hold. I'm just going to move forward into the active work. But know that you can pause this video and spend time anywhere from 30 seconds to 2 minutes, okay, depending on your body's needs. Okay, we're going to start to work into that right hip with PAILS rails. So PAILS, we're going to drive our right foot, right shin, and right knee into the floor, hitting 20% intensity. And I want you to think about that front leg sweeping out in this action, okay? As if we could push the floor apart and out to the opposite side of the room, okay? 20% intensity, 21, 22, 23, hitting every number in between as we increase. 30%, 40%, keep increasing, 50%, 60, 70, 80, greatest, safest effort. Hold that intensity for 10, 9, 8, irradiate tension in your body. 6, you should really feel that right hip. 4, 3, 2, drive your knee down. Now try and lift the foot up. Nothing is going to change in the body. We're just at the hip joint. Don't let anywhere else come into play. 40, holding, we're increasing. We're holding that same amount of intensity and we're counting down. 5, 4, 3, 2, and relax the leg. Take a deep breath in. Deep breath out. So we ramp up the intensity for our PAILS, we hold our greatest, safest, and then we just go right into a great safe effort for the rails contraction of where we're lifting up. So let's do one more just like that. Pressing down, right foot into the floor as if you could sweep the leg out. 20%, 30%, 40, 50. So we're just increasing our time under tension. 60, 70, 80. Your greatest, safest effort, hold this work for 10. Try and maintain the same amount of intensity. 8, 7, 6, 5, 4, 3, 2, and rails. Drive the knee into the floor. Try and get that foot to lift up, holding for 10, 9, 8, 7. Maintain it. Feel the deepening of that stretch in that right leg. 4, 3, 2, and relax all of the tissue surrounding that hip joint. Maybe you're able to find a little bit more range of motion. Navel forward, tailbone back. Take a few deep breaths. And I encourage you to hold this for another 30 seconds and then repeat for a third round of PAILS rails. Okay, after that third round, you'll walk your hands back up, and then we're going to sink into the trail leg. So we're going to turn our body towards that trail leg. It's okay if that foot is closed in and that knee joint is closed, or you can maintain this 90-degree angle. Okay, hands will be back behind us as far as you need to. So same as the front leg, we may need to kickstand out to the side for the front leg. We may need to kickstand further back with this back leg. Okay, you might be all the way down here on your elbow. You might be able to sit up nice and tall. Okay, just depends on what your body's capability is in that front leg. So find a position, sink the hip towards the floor. You're getting this deep capsular stretch in the front of that hip joint. I want your back to remain straight as well. So neutral spine, chest is lifted, natural curve in that low back. So we're not rounding our back here to the best of our ability. Okay, it might feel impossible at times. And we're gonna hold this stretch. Okay, and then we're going to do some PAILS rails here. We're going to be driving our foot into the floor as if we could sweep the leg out like so. And then we're going to be attempting to lift the leg off the ground. Again, it's not going to go anywhere because we are putting ourselves at our end range of motion, and that's where we're spending time working. Okay, so let's start our PAILS. You're going to drive your foot into the floor. So pushing this foot down 20%, 30. If you feel any pain or discomfort, back off. 40%, listen to your body and stop at your greatest, safest effort. 40, 50, 60, 70, 80. Hold for your greatest, safest effort for 10, 9, 8, core is tight, irradiate tension. 5, 4, 3, 2, drive the knee down, try and get that foot to lift. Holding for 10, greatest, safest. 9, 8, 7, 6, 5, 4, 3, 2, relax the leg. See if you can sink that hip a little closer to the floor. See if you can relax the knee, relax the hip. Deep breath in, deep breath out. If this is too much turning towards the leg, you also have the ability to turn towards the front leg and sit as upright as you can, okay? Again, trying to find that nice neutral straight spine, and then do your PAILS and rails work here, okay? Turning straight forward. So we would be driving the foot down for your PAILS and lifting the foot up for your rails. So find what works for you. Find what's going to give you the max amount of benefit out of this PAILS rails work, okay? And then when you're finished, you'll just switch over and do the same amount of work on the opposite side.